Hi guys, welcome back to Medical Coder Life. Today I wanted to share with you, I'm sitting in my car waiting on my child to finish soccer practice, and I figured, well, since I got to sit here for the next probably 30-45 minutes, I might as well use this time to share with you something that I was going through at work. I work for an outsourced coding service. So in other words, where facilities are backed up, or to be honest with you, with ICD-10 coming in, a lot of facilities just opted not to train coders and just hire outside companies to come in and do their coding for them. So I work for a company that does outsourced coding. And last week we were hit with a big project, and I was asked by my boss if I had ever done injection and infusion coding. Well, guys, this is what I mean when I tell you guys, don't think that you have to know every single thing about coding. I have been in coding and HIM. Yes, I was on the management side of it and I didn't have to do it daily. But guys, I've been in this profession 28 years. 2018 will be 30 years. So I hit a 29-year anniversary this year. Anyway, I've been in this profession so long that a lot of the stuff is still new to me. So when I was asked if I've ever done injection and infusion coding before, no, I have never done it. So what did I do? I immediately started researching. I pulled every resource I could find. And guys, my best resources were right online. I Googled, what is injection and infusion coding? Found 3 good articles written by third-party payers on proper coding for injections and infusions. And then I pulled out my CPT code book and was able to view the guidelines within the CPT book on infusion and injection coding, and learned so much. I feel confident in it that when I did a training on Friday with a person that's designated to train us, found out they were using software to generate the code. The software, they just go in and they put, whether it was an IV, start and stop time, and then the software generated the code. And what I had to tell her was, stop. Before you have it generate the code, let me tell you what the code is. And I did it manually. So that's how I know I feel pretty confident in my coding. But just learning it online and taking the time to study the guidelines on it, and then studying my code book. My biggest thing I always tell you guys is love your code books, right? My code book gave me all the answers that I needed. So if I'm not able to share anything else with you while I'm sitting in my car waiting on my child to finish his soccer practice, let me at least tell you little tidbits of things that I experienced to help you guys. And main thing I want to stress to you guys is you cannot know every single thing there is to do in coding. I mean, I've got my RHIA, I've got my CCS, I've got my CPC, and I have never done injection and infusion coding. So also in studying for that, I tried to find out what diagnoses do I need to be familiar with, or that involve injection and infusion coding. Like with the injections, it's pain medicine that's injected through the syringe. I've seen cases like that before. I've never had to code them, but I've seen it. With the infusions, chemotherapeutic drugs for cancer patients, or other types of... Anyway, what I'm trying to tell you guys is, with my research, I tried to find diagnoses that pertain to injections and infusions, so that as I find these charts, I'll know to look for them. And I know now also to look on the medication administration record, the MAR. And that's one of the forms I'm also going to cover on this channel, as I'm covering physician documentation forms in the record that help us find our diagnoses or confirm our diagnoses when we're coding our charts. So again, that's my little tidbit for you today. I think I'm going to be out here 4 days a week, 5 days a week. So hopefully I'll try to remember to bring my camera. And as I experience things on the job, I want to come to you and share those little tidbits with you. Share little ideas with you on how you too can learn as I'm learning, and as we're experiencing our medical coder life, so that you too can learn to do the same thing. All right, guys, I'll see you in my next video.